Continuing in our Hidden Effects of Medical Procedure series, some of you may have had weird hip pain and wonder why, but in your background, there's a cardiac procedure. And you're like, Cara, why are you covering cardiac procedures? That's so rare. Well, actually, there's almost 1 million of them done annually in the US alone. So there's a lot of you out there, whether it's a stent placement or just a test, that you've had a cardiac cath lab procedure where they are accessing the artery or your heart through the artery in your hip. So I want to show you what happens. They're going through the crease in your hip, and usually what I find is people end up with a tightness here or in their lower back on a day-to-day basis. And it's just the body's way of protecting that, because whatever's been inserted, a probe or stent or what have you, that artery, it's a pretty vital part of your body, and your body's afterwards protecting it to make sure it heals, but there's nobody telling it to stop protecting. Okay, by the way, this is Louise, who's graciously our demonstration person today, helping us in this series. And I'm Cara. I'm the founder of the Bridging Institute, where we use the technique to reset how your muscles are working together, especially after medical procedures. So what we find really just needs to happen here is that this whole area needs some support, just as we've seen in some of the other videos in this series. And whether I use peanut balls, they're soft, they're very supportive. We could use a compress. You could even use a hoodie if you have, but just something that you can kind of fold up and put some support. How does that feel? Yep. Feels nice, yeah. And so what we're waiting for, again, is with other videos that you've seen, is just you feel the muscles just take a deep breath and relax. And the thing that's tricky about this is we may have to do it a few times where we get more specific, where we are just globally across the hip joint as a whole. And then depending on where exactly the scar is, that we maybe use a more pointed, more specific hold. And again, we're just waiting for that relax and sensation. And then give a little rock. Oh, you didn't even have this, and I just felt your body relax. Yeah, so we just give a little rock and then hold, and that's it. It just helps your whole entire system just relax from holding that tension of the procedure in. And again, this could be 6 months, 6 years after you've had that procedure. I've even had where it's been 20 years. And that is tight, and then it changes. It's your body is just holding on to that, and that's the most current memory, and we want to reset that memory into a movement-based memory. So again, if cardiac cath lab procedures and you've got a tight hip or even just a pain there, this is why. And if you found that insightful, please do give us a like and hit subscribe, because we've got a lot of other medical procedures that we're covering, because they really throw your muscles a loop, and they get confused on how they need to work together. If you're a professional and you would like to learn more about bridging, please check our website for our workshops and our courses, and we'll look forward to having you there. See you next time.